Hi, my name is Egelinda Erica, and I'm a public health student. I'm also part of the residential honors program, and I'm here to present my public health capstone today. So our project was to create an intervention-based grant proposal. And so mine was taking a look at the national health education standards here in Hawaii and assessing that there is a gap in actually the rollout of these new standards and trying to improve health education here. So they were originally published in December 2019 with an expected rollout for 2020, 2021. But since then, COVID-19 has hit, and I think a lot of other learning, just, even if it's math, English, science has been very stunted for our students here in Hawaii. So I think it just overall, it's time to, now that we're going back into school, it would be great to focus on adding more to, contributing more to the, hopefully the school year 2023-2024 full rollout of the new standards for health education. And this year they revised them and included Nahopina'a'o and Ha-breath, and then they include more Hawaii-based language around health, made it feel a little bit more culturally competent and a little bit less just general, but more specific to Hawaii. So these are the 8 standards, and then these are the priority risk topics. So teachers are meant to look at the standards and then teach from them. And these priority risk topics is that way they can have a means of conversation and having something to talk about with the students while they're giving their lectures. And these are taken directly from the national ones. They're just being implemented here in Hawaii now. And then Nahopina'a'o is the new framework, the new teaching framework for all of education here in the Department of Education. So it's going to be belonging, responsibility, excellence, aloha, total well-being, and Hawaii. This just emphasizes that Hawaii is a unique learning environment, and that teachers should take as much advantage of that, and students should as well. And it goes a little bit more in depth in the policy, but this is just a brief overview. So on my intervention that I actually am doing for a separate class for my residential honors class with Holly Tarver, you might see my presentation before or after this. But the barriers to this is that the standards come up as what students should be able to do. But instead, it should be a reference guideline for what teachers should teach to, not just an end goal. It's nice to have a goal, but they need something to get there somehow. And so also teachers often teach towards testing. There's no current or planned testing for the standards, and we're still transitioning back from the pandemic. As I said before, I'm sure some of you as parents, you were seeing that your child is struggling a little bit more trying to catch up with what they missed from online learning. And so the teachers are more focusing on trying to catch the students up and probably not as focused as learning something new. Or teaching something new. And so in this 70-page document that's very extensive, there's separation between the standards, the priority risk topics, and the Hawaiian culture and perspective. It doesn't seem as cohesive as I would, we would all like it to be, but which is why this project, I think there's also a few gaps. So the whole purpose of this is to hopefully encourage healthier behaviors. As I said before, Hawaii is a very unique environment. And if we can target these behaviors and early on, and while they're still children before they're adults, we can improve their overall health, and we can also improve their quality of life so that they have reduced communicable and non-communicable diseases and injuries. Because we want our kids to be happy adults when they grow up and a happy childhood. So this is a brief overview timeline. As I said before, I actually am doing this project currently, and I have the separate presentation later on. But this is a timeline of how Holly and I are completing this, and just it should be completed by the 8th, and the website should be user-friendly, functional, and content presented and defended. So our budget is about, so we're trying to, for the mock proposal, I'm applying for a $25,000 budget. But for this, I would need a minimum of about more or less 2,200, I'm sorry. So I would, if I had the funds for it, I would use Notion as my website service, and it would be for 2 users, myself and my peer. And we would both be able to use Canva as well to go ahead and work those lesson plans and adjust them based off of feedback or whatever we see is new. And this is for a 5-year projection. And so that way the website is running and clear, and we have access to adjusting our old lesson plans. I really appreciate you guys taking the time for reviewing my project. If you have any questions, jump in my room. I will gladly answer them. And mahalo for your time.